Everyone has experienced sadness, not everyone has experienced depression. In fact, if you've never been depressed, chances that you don't have a real grasp on what living with this complex mental illness is like. Depression is insidious. It affects not only your mood, but also your ability to feel, think, and function. It blunts sensation of pleasure, closest of connectedness, creativity, and at its words, it shuts down hope. Also often causes deep emotional pain not only to the person experiencing it, but also to the person's close family and friends. Typical signs of depression in adults include persistent feelings, sadness, emptiness, feeling irritated, overwhelming feeling of guilt, anxiety, frustration, or anger, changes in appetite, inability to concentrate, and loss of interest in previous enjoyed activities, among other symptoms. What is psychotherapy? Psychotherapy is also called talk therapy. It is a type of mental health treatment. It's often used either alone or with medications to treat mental disorders. During a psychotherapy session, you talk to a doctor or a licensed mental health care professional to identify and change troubling thoughts. Hi Ken, thanks for coming today. It's nice to meet you in person. I know it can be nerve-wracking to meet a new therapist, and I'll be asking some personal questions today, so I thank you for taking the step to come in. Today we will have a little bit of different meetings than the regular therapy season. Today I will ask some questions so I can understand what's been going on. But don't worry, you can ask me any questions right back if you want to. I'll answer any question that you have, but it's okay if you don't think of any. After I ask my question, I'll share to you my thoughts and observation about what you've told me. So you always know what I'm thinking and make sure I really understand. Then I'll share to you my initial thoughts and plans of how I'm going to help you feel better. Okay? Great, let's start.
Well, I had just been feeling very anxious.
I'm sorry to hear that. It's really hard. We see a lot of that here in the practice, so you are not alone. May I ask, when did it all start?
I started feeling worse a few days ago, but last night it got really bad.
What happened last night?
The thing is, that all night I was feeling nervous and jittery. I couldn't relax. My wife was really worried. I tried to go to bed and fall asleep, but I couldn't. Then, all of a sudden, I felt short of breath. I was gasping for some air, as if I were drowning.
Did you have any other physical symptoms like pain?
Yeah, I had a terrible headache back here in the nape of my neck.
You said, Mr. Ken, that you have been feeling bad for several days. What had you been feeling?
At work, I couldn't concentrate at all. I was irritable with everyone. My nerves were short. Every little thing that would stare at me. I didn't have any appetite. Whenever I eat, it would make me feel nauseous. But the worst thing is that I couldn't sleep at all. I think it's been like 4 nights now that I have hardly gotten any sleep.
Now I see from your chart that you've been seen by a psychiatrist for anxiety in the past. Were you ever prescribed any medication for anxiety or depression?
Yeah, he gave me 2 pills.
Did they seem to help?
A little bit. The thing is that I took it for several days and it really didn't seem like it was helping much. It just made me feel tired and numb all the time. I don't know how to describe it. It was hard to concentrate at work. I was scared that I was going to get fired and I really can't afford to lose my job. So I just decided not to take it anymore.
Well, antidepressants can take several weeks to have an effect. So, you really need to stick with it. I think it would be good for you to follow up with your psychiatrist again. There are many kinds of antidepressants out there. Maybe he can try a different one to see if it helps you.
Okay, but the problem is that because I've missed a few appointments, supposedly that psychiatrist doesn't want to see me anymore.
If you give me a couple of minutes, I can make some calls and see if you have been seeing at the clinic. At this point, Mr. Ken, the most important thing for you is to get regular outpatient care to get your anxiety under control. Give me a few minutes to make some calls and I'll come back and let you know if what I have found. Sounds good? I called them and they are not able to see you again at the clinic. We have a clinic associated with our hospital. I will make you an appointment at the clinic if that's okay with you. We use interpreters at the clinic too, alright?
That should be okay. I will try to do better this time getting to my appointments. Thanks for everything.
Benefits of psychotherapy. Psychotherapy helps people with mental illness to understand the behaviors, emotions, ideas that contributes to their illness and learn how to modify them. Understand the identity of life problems or events, like a major illness, a death of the family, a loss of job, or a divorce that contributes to their illness and help them understand which aspects of those problems may be able to solve or improve. Regain a sense of control and pleasure in life. Lastly, learn healthy coping techniques and problem-solving skills. That could be all. Thank you.